Okay, welcome everyone, and thank you all very much for taking the time out of your day to come and let us talk a little bit about the Medicare program. Again, my name is Ronald Williams. I'm with the Louisiana Department of Insurance. I represent a department called SHIIP, and SHIIP stands for Senior Health Insurance Information Program. There's one of us in every state. My first time using this clicker, so bear with me. Every state has a SHIIP. Some of them spell it different. Texas calls it high cap, but there's one in every state. And what we do, we represent you. We're your counselor. We're the one that can help you with issues you may have with your provider. We help you with your billing. We answer questions, and you'll see our numbers on the green brochures in your folder, in which you can call us up anytime, and we will help you try to resolve some of your issues. Again, it stands for Senior Health Insurance Information Program. We also have a staff, we have volunteers, we have partnership agencies that we work with, and the whole idea is to counsel and help you make decisions and have options. There are 730,000 Medicare beneficiaries in the state of Louisiana. Everyone knows about the concentration that usually happens in New Orleans and Jefferson, high populated area. But what we're trying to do is hit the rural area, because that's where the information is not being given out. Today we're going to talk about what is Medicare, the components of A and B, original Medicare, what is the supplement, components of C and D, and assistance program. What is Medicare? As I was talking to one of the young ladies in the back, we talked about different type of Medicare. We talked about how do you qualify for Medicare. We're going to put all these up here so you have a look at them. Okay. Qualifying for Medicare. 3 months before your 65th birthday, you should notify Social Security that you want to sign up. Now, you have to be 65 or older, or under 65 if you're disabled and claiming disability for 2 years, or if you have end-stage renal disease. People my age know it as Lou Gehrig's disease. We are under the Center for Medicare and Medicaid, which is out of Dallas. That's our boss. This is a federal program. We represent them from a federal standpoint. We represent you to handle issues. I'm sure you're having a lot of issues going on TV right now, a lot of fraud going on. There's a lot of billing mistakes going on, where some of it accidental or some of it by plan. But we're trying to hone in on making you aware of how to detect some of these. Again, we're under the Louisiana Department of Insurance. There's about 16 SHIIPs around the country that are under the Louisiana Department of Insurance or under their insurance department. Some of them are not under their insurance department. Some of them are what you call freestanding. As most of you know, there are 4 parts to Medicare, and I see some of you shaking your head. The first part, called A, deals with your hospital. B, your medical insurance. Part C, we're going to get into, which is also called Medicare Advantage, which is your HMO, your PPO, and also include a Part B and a Part D, which we're going to discuss later on in the slide. Part D is your prescription. Part D is the only alphabet that means exactly what it means, and it's drugs. Everything else, A, B, and C, does not correlate to what their purpose is. How you enroll in Medicare. Everyone is familiar with the red, white, and blue card. Okay. If you are receiving Social Security and if you have paid into the system, you'll see that you automatically enroll. Or if you're getting...
The same for railroad retirement?
Yes.
It's the Same thing.
Same thing.
Okay.
If you are getting your disability for 24 months when you turn 25, you automatically enroll into the Social Security, and you automatically enroll to Medicare. Same thing if you the question comes in sometime when you talk about enrolling is, what do I do with my card? 3 months before you should now. Now, we're not going to hold us to this because talked to one lady today, she said she never received a book. Everybody's supposed to read a book every year. But 3 months before you turn 65, you should receive a Medicare book. Once you enroll, you get a red, white, and blue card. And as you're going to see in the slide, if you do not want B, send the card back. If you keep the card, to them, you automatically enroll in A and B. We're going to discuss that going down the road. Slide a little slower here. Just like I just said, 3 months before you turn 65, it's imperative, very, very, very imperative that you enroll. Now, most of you probably have already. But the reason why it's so important is if you miss that 3 months before your birthday, the month of your birthday, and 3 months after, anyone know what happens if you don't enroll? You're penalized for the rest of your life. So it's very, very important that you remember that date. And it tells you here the total of 7 month enrollment. Now, a lot of people get confused because they think, well, I don't have to enroll because I'm going to still work. And we're going to discuss that. Your general enrollment period is January 1st through March 31st of each year. Coverage began in July of that year. You see what your penalty is when you don't enroll? 10% for every 12 months that you have not enrolled. I spoke to a gentleman yesterday, and he was 70 years old. And he said, I never enrolled. Just didn't do it. What should I do? I say, well, I don't think you want to go back 10, 15 years and pay a 10% penalty and enroll because it doesn't benefit you. I mean, the cost would be astronomical.
Why do they penalize someone? Why?
It's part of the program, man. I can't answer why, but it's part of the program. And I think also, you're going to see down the road, some people are undecided when they turn 65, or they're still going to work, and they're going to have retirement cover. And believe me, that becomes a mass confusion. Talk to any person that's about to retire, and any person that's trying to decide. And a lot of time you're going to hear in the slide that the first thing you should do when you talk about retirement is go talk to the benefit person in your office, whether it be union, whether it be an employer, whatever, and they will help you, give you information on how you should handle it. They don't, you call us.
But excuse me, there wasn't always that 10%.
No, it wasn't.
No,
No.
Just come about in the Bush administration when he penalized us if we didn't get Medicare Part D.
You're probably right, man. I can't comment on that.
Yeah, I know.
Yeah, right.
Yeah, like you said, it's all politics.
Right. Okay, so we know about Part A. Let's talk about Part B enrollment. This year, we're going to put some of these slides up. And here's what we were talking about. Benefit may want to delay enrolling in Part B. What that means? Once you enroll, and you have, if you don't want Part B, you send the card back. But you go talk to your benefit person and you decide that, well, I'm going to continue to work. And the word is, if you have credible coverage, which is the same as Part B from your employer, whoever you're retiring from, you don't have to take Part B. But you have to notify Social Security that you're not taking Part B with a letter from your benefit people that you have credible coverage. And the reason why you want to do that is because if you don't send that card back, if you don't notify them you're not taking Part B, you can have Part B for Medicare and you can have credible coverage from your company. So what you're doing, you're paying twice. You're paying twice. So that's why you want to sit with your benefit person and decide if you have credible coverage, you don't need Part B. Now, once you decide that you do not want Part B, you've sent the card back, you have documentation, you're now under your credible coverage of your company. But if that goes away, for whatever reason, then you have 8 months. Once it goes away from your company, you have 8 months to go back and get Part B without a penalty. Everyone understand that? Without a penalty. But if you do not, and that 8 months pass, you're penalized on Part B. So now we're talking about 2 penalties.
How much are you penalized there?
Part B, it represents the same type of penalty, like a 10% penalty. You see? Yeah, you're going to see as it goes on, if you're not proactive, you could be spending a lot of money. And then you're going to understand why, when we get down further in the slide, we talk about saving people money. It's just the little things that people are not aware of that can help you save money, simply because you weren't aware of the little things you could do. Yes, ma'am.
Would you explain, I know a lot of people probably don't understand the difference between Part A and Part B.
And this slide, this slide was 72 slides long. We cut it down, and it's supposed to be on here, and I'm going to go back and see. I don't think it is. But Part A is your hospital. Inpatient. Now, since you brought that up, let me tell you something. You have a situation, and you get rushed to the hospital. You, your spouse, your children, whoever, you get rushed to the hospital. And they, in hospital, do all of the tests and what have you. And you're there a day, 2 days, 3 days. Then they send you home. Do anyone know if that's covered under Medicare? The answer is no. Unless they admit you. Inpatient. Remember that. I didn't know that myself. Many years ago, I rushed my mother-in-law to the hospital. She's making 90 years old. And if they don't admit you, then it's not covered because you're not an inpatient. It's considered as outpatient. So if they're going to keep you and just running tests, it's not something serious, send me home, and I'll go see my doctor Monday.
If you have Part B, then would Part B pay that?
Well, Part B would pay that outpatient.
Yeah.
Yeah. But I'm saying they don't admit you.
Right.
Okay? Because if they admit you, it's under Part A. So she's absolutely correct. That's a little thing that people don't think about. They think, well, I'm there. They ran tests. They did everything. I'm in the hospital. I'm in the emergency room. But they never admit you. So that's the question there. And it's not in here, but what I want to do, since it's not on my slide here and we just changed it, in your Medicare and U book, everybody take the time and go to if you go to page 28 on, and I'm not going to go through all of it, 28 to page 31, and you can read it at your own time. The reason why I want you to use your books is because you know where to find it. It tells you everything that Part A covers. And when you start looking through it, you don't have to have any doubt when you're in the doctor's office. Now, something else that's very important here. When you're at the doctor, we have found that a lot of Medicare beneficiary people just shake their head. The doctor's talking. Everybody shakes their head. You got to ask the questions. You're going to see why it's so important to ask questions. Take notes. If you can't Bring someone with you. Take notes. Ask questions. Check your bill. Because you'll find out that there are options that you can do that can help you save money if you ask questions. And you're going to see down the road, down the slide here, such as, this medicine is too expensive for me. I can't afford it. Ask questions. We have a pharmacist that we work with, and he says in their research they found out that a lot of people do not ask the question. They don't check their bill. They don't dispute things, and that's add to your cost. But that's where you find what's covered under Part A. Because once you go to page 32, and you know I'm deviating from the slide because information I want is not here.
Could I ask you something?
Yes, ma'am. Go on.
Part A? A couple of years ago, I was had heart problems in the hospital. Well, the doctor came in, it was on Sunday afternoon, okay, and he said I needed a stent, but he wanted to wait till the next morning when his full staff was there. Well, they must not admitted me as an inpatient because he did the stent the next day. Medicare paid everything but the hospital bill.
Because you,
And I went round and round with them for months and months. And finally, the hospital said they wrote it off.
right. That's why you have to ask questions, number one. And
that's
two,
why I guess they said the hospital
you would,
didn't file it right.
didn't admit. Well, that's another issue. Two things. One is they probably didn't admit you, or they probably coded it wrong.
Yeah, they coded it wrong.
See?
Yeah.
They probably coded it wrong.
Yeah.
Okay, but if you have any problem with any concern, any bill, don't be afraid to appeal. That's not on a slide, but in our one-on-one conversation with you over telephone, you can appeal. So you appeal and it doesn't get approved. Do you stop? No.
The hospital kept
You keep appealing. You keep appealing. Because if you know something is not right, if you know something you're supposed to have, a coverage you're supposed to have, keep appealing. Because I had a friend, his son is now 35 years old, and he is on Medicare, but he's disabled. He was born with tumors, cancerous tumors. He wasn't supposed to live no more than 3 weeks as a baby. He's now 35 years old. They remove about, when he's about 12, 15 years old, they remove a large tumor from his body. And at that time, he also had seizures. Well, at age 14, 15 years old, after they removed it, it still was his body filled with cancer, and it affected his right side of his brain, so they operated on the right side of his brain, and 2 years later, they operated on the left side of his brain. 2.5 years ago, his kidneys failed. He had to have a transplant, and they told him that if he didn't have it in 90 days, he was going to die. Miraculously, it's a long story how it happened, miraculously he was able to be provided for the kidney. And it happened from a young kid that was doing a rush. Everybody know what a rush is? Young kids were doing a rush where you hang yourself, and just before you pass out, you catch yourself. And this young kid did this, and he didn't catch himself, and they was able to get a transplant. Well, about a year ago, after they wanted to make sure that his body accepted kidney and the transplant, Medicare was going to drop him. No longer was going to be under Medicare disabled. And the reason why they wanted to drop him because of the transplant, but also he wants to start taking his seizure medicine back again. He said, no, can't do that. His father is a lawyer, young man I know all my life, and they did paperwork after paperwork. From the time he was born, doctors wrote letters and letters, and they appealed it. Went to the first appeal, and then appeals again, went to the second appeal, and then the third, and so on the fourth, they had to do some more paperwork and some more studies, some more information, and he had all this laid out. And I tell you, the paperwork was that high from the floor up. finally, a month ago, he got the final appeal and say that, okay, you're permanently disabled. We're not going to drop you. That's how you have to be persistent and keep, and never. You're going to hear a lot of horror stories and a lot of things that some of you may be able to identify with, but the ideal of it is there's no one answer. There's no one person that can give you the knowledge to everything about Medicare. It's a one-on-one situation. It's a one-on-one. You have to be persistent and don't let it just go by the wayside. We're talking again here about delaying in Part B, and that's mainly if you're going to continue to work and you're not going to take Part B, see what you do. And again, it's a contact your benefit people and ask them. TRICARE. Everybody know what TRICARE is? And TRICARE is very simple. If you are a retired military person, to keep your TRICARE, you must have B. You already have A, because TRICARE A, but to keep it and you're retired, you must have B. If you're active, you don't need B until you retire. Well, it's almost pretty much like taking B and not taking B based on if you're retiring from a company. That's your Medicare and your coverage under TRICARE. Okay, now we're going to take a closer look at A, and you ask what A covers. As the slide shows, this is what A covers. Usually, and the reason why I say usually premium free for A, if you haven't paid into it, 40 plus units, you're not covered. It doesn't automatically keep you covered. So for people who have worked and paid into it, A usually is free. And here's what it covers: inpatient, and here's that word, inpatient. Key word, inpatient. Ask the question. Skilled nursing facility care, hospice, blood. And it goes into for your home health care. That 20% figure appears in mostly every aspect of your coverage. Medicare don't pay all of it. You come up with your copay of 20%. Anyone know what DMS means? Durable medical equipment. Your walkers, your scooters. You've probably just heard, everybody heard what happened with the scam going on with scooters, scam going on with walkers, scooter store, things of that sort. On the news they had where people who have scooters and people who have walkers and other durable medical equipment that doesn't qualify for it, don't need it. Everything comes down to scam. Never, ever, ever give no one on the telephone, unless you're in a setting like this, or if it's your provider, your Medicare number, your Social Security number. Medicare does not come to your door and knock on your door. We're doing the analysis here on the paperwork I gave it with application. We can go into CMS, the Center for Medicare and Medicaid. We can go into that system based on information you give us and tell you exactly where you are, what you have. If you're getting extra help, talk about that later on, by sharing your meds with us, which we don't discuss in the open, but you share that with us, we can tell you where you are, what you're taking. And then once we have that, we can do that analysis, hit a button, and it will show you options. Options. What you can do, what you can change to, how you can save money, because it changes every year. Whereas you may have had 4 or 5 brand that you're taking. Now they may have 2 or 3 generic, or alternative, or equivalent that will cost you less. So that's why every year you should have an analysis done, because we don't know, you don't know what the change is going to be. But when they change, a lot of time it's going to affect you either positive or negative, but it will affect you. But we can tell you what your options are. That's why you want to have an analysis done. Inpatient. First, your deductible. First 1 to 60 days, I'm sure you all have seen this. Most of you all have experienced this. $1,184, again, in your packet. If you look in your packet, it's this sheet. It's this sheet in your packet. Again, when I'm not trying to make you experts on all that, but I want you to look at what we have in the packet on the screen, give us your information, let us talk to you one-on-one, and we will be able to give you some options.
Is it still, I know it used to be, if you come back in on the 59th day, you don't have to pay that deductible?
That's exactly right.
Every 60 days, if you come in for a new,
It's a new,
deductible's not just one time, it could be 3 or 4 times a year.
starts over. If
Starts over every 60 days?
right, if you come in after that period, it's like you're coming in for the first time. Again, they talk about your copay, what it is per day. Your lifetime reserve payment, $192 per day for the days 90 to 150. And then if the doctor recommends that you go into a skilled nursing facility, that's what you pay. And again, your doctor is a key. He writes the prescription. One lady asked me, well, how do I get a walker? How do I get a scooter? How do I get my diabetes? How do I get? Tell your doctor to write a prescription. That's how you get it. Write a prescription.
Jim write a prescription for 90 days. They'll write one for 90 days.
Well, we're going to get into that 90-day thing, too. So that's a misnomer, and since you asked the question. If you're in December, should you order 90 days of medicine and you're in December? Some people do it. No. Because it starts over the next year. Everything starts over at 0 the next year. So you need enough. You can get enough from the pharmacy to take you into January, where all of your deductible percentage copay starts over. Learned that from a pharmacist when he was teaching. He said that's something that people do. You don't have to order 90 days in December. Save yourself some money. You start back over in January the next year at 0. I mean, everything starts over. Understand? Something else on that line which is very important to save you some money. Don't ever split your pill unless it's scored. You know what scored is? That little line run through it. If it's not scored, and I know it's tough times. Some people do it because they think they're saving money. You're not. You're not only not saving money, but you are affecting the time release of that pill if it's not scored. When a pill is not scored and you take it, that first layer releases whatever the doctor prescribes to do for you. Then down the road, the second layer releases. But if you cut it, you have just interrupted that time release. Don't take anybody's medicine. You may think you and your sister, you and your husband have the same symptom, the same everything. Dangerous, very dangerous. Don't take your friend's medicine. You don't know if I got 90 days of medicine left here. I don't have to take it. When year starts over, I'm going to get some more. You can have this. You don't know how they treated it. You don't know where it was stored. You don't know how it was touched. That also affects your health. Yes, ma'am.
What about capsules?
Capsules are not time release, but you still don't want to cut it. You still don't want to cut. No.
Usually
Right.
on that sheet of paper you get from the drugstore, it'll tell you if you can, that you're not supposed to.
Right. But some people don't. You gotta understand. Again, a lot of people don't ask the question. Number one, and number two, some people think it's okay. You might not have the knowledge. You think it's okay. Oh, it's a pill. Instead of taking it one a day, make me feel so bad. I'm gonna take half. You're interrupting the process. Again, we're talking about doctor services, outpatient surgery and supply, home health, DMS, all this. And again, if you look in the book, it gives you more. When you look under what Part B covers a lot. I mean, if you Part B goes from page 33 in your book all the way to page I want to say 52. That's what Part B covers. I spoke at the NAMI. Everybody know what NAMI means? That's the National Alliance for Mentally Ill. And some of them wasn't aware that mental illness is covered under Medicare. Someone wasn't aware. And I saw one of the ladies in the audience looked at me. If you go to page 30, look at page 30 in your book. Hospital inpatient talks about what it covers. And in that first paragraph, it talks about the semi-private room, the meal, the general nurse, and the hospital service supply. This includes care you get in acute hospital, critical access hospital, inpatient, rehab facility, long-term care hospital, inpatient care, a part of qualifying clinical research study, and mental health care. Then, if you go to Part B, and you go to page 42, and it tells you all about mental health care outpatient. And I spoke to a gentleman, and he said he didn't know that. Now the problem they're having is that they're trying to find psychiatrists that take Medicare. That's the biggest problem here, and we're about to give them a list. That's a little hidden thing that people didn't know. They didn't know. Yes, ma'am.
Page 35 is talking about chemotherapy. I had heard recently that after you're age 75, they're going to be changing that Medicare will not pay for
There's a lot of
treatments.
rumors out there right now of what they're not going to do and what they're going to do. It's undetermined right now. I talked to a military guy 2 weeks ago, and he said he heard that he was going to have to start paying money for Medicare. I haven't heard that. I haven't found anything that says that. So you got a lot of rumors floating around right now. Yes, ma'am.
You're speaking of rumors. You know, we hear things, and I just wanted you to sound very knowledgeable.
No, I'm not. I'm just, believe me, I study and study. I've been in this.
We can't understand everything.
I've been in this program, my career, insurance, banking, economics. I've been in this program since September. I'm on loan to the SHIIP department, but I read, and I go to seminar, and I read, and I study, and I read, and I study. And my job is not only outreach, but my job is to try to make it simple. I've done it all my life, 44, 45 years in my industry, and I try to make it simple because you're going to see some changes. I don't have it. There's so much information. And what we have done in the SHIIP department, we have made cartoons. They got some brochures that we're going to be sending out, and if you want them, it's a cartoon. And why is it a cartoon? Because learning from my mother, who died in 1990, and a lot of people on Medicare, when you get to a certain age, you can see it better than reading all this.
Right.
That's why this is nice, but if you can see it visually, you can learn more. For instance, and I know I'm deviating, but for instance, the donut hole. Everybody's afraid of the donut hole. We have a cartoon. We have a cartoon that explains the donut hole so simple, and it's not in your packet, but explains it so simple. I don't think we put it in the packet. I think it might be out. But what the donut hole is, up to $2,970. When you spend that much for your bed, and we use a cartoon, the guy's walking along. He's walking along, and all of a sudden, he didn't spend $2,970, and he falls into the donut hole. Now, before affordable health care, while you're in that donut hole, you had to spend roughly $3,700 of your own money, whether it came from help with prescription med from the pharmaceutical company, whether it came from help from the family, wherever it came from, you spent $3,700 and you got out of that donut hole and you paid 100%. Well, affordable health care, while you're in that donut hole, give you a break of 52% roughly of discount on brand medicine and roughly 21% on generic while you're in the donut hole. Once you reach that 3,700 plus figure and that 2,970, it equates to about $60-some-odd, you're out of the donut hole. And then your med costs you anywhere from $2 to $6. That's the donut hole. There are ways that I've learned working with pharmacists that you can delay getting in that donut hole. Now, if you have medicine cost you $1,200 a month or $400 a month, you can get in that donut hole real quick. But if you can talk with your doctor and find out based on your prescription med, your formulary lists, or what you're taking, or their alternative, or their equivalent, or their generic that costs less, then you're paying less, then that can delay you from getting into the donut hole. Understand?
Excuse me, that Affordable Health Care Act that you're talking about, that's HB 3200, House Bill 3200?
Can't tell you like what House Bill, but I do know
It also says on that the government will have time at page 58 and 59. The government will have real-time access to an individual's bank account and will have the authority to make electronic fund transfers from those accounts. And it says on page 272, cancer hospitals will ration the care according to a person's age. And it goes on and on.
Oh, yeah.
So, in fact, after you reach 70, 75, if you get sick, you're just up, you might as well stay home and die.
Again, ma'am, you're talking about Congress.
And that's that affordable health care bill
Yeah.
they
Right.
passed, Obama's.
Right, right.
Obama.
And again, ma'am, you're talking about politics right there. I'll get into that part of it. I can only tell you what the Medicare is right now and how I can help it.
Yeah, the only good thing that I can understand about that is the donut.
They don't know. That's right. I agree. I totally agree. Now, again, you're going to see a lot of information. They're going to come out to explain to you or to tell you what's going to happen. They don't even know.
No, the politicians didn't even read it, I don't
No,
think.
it
Yeah.
only was
Yeah.
700 pages.
Right,
No, it would
right.
have been impossible, so it's really difficult for people today.
But they ramrodded it through, and now we're gonna have to live with it unless we get another president in there that'll do away with it.
Right.
What they need to do, they need to have politicians need to have the same care that.
Right.
The only good
Right.
thing
If they had this, they had the same care we had.
Right.
They
Yep.
would do this.
You're right, ma'am. You're absolutely correct.
That's the
Well,
exact.
you've gotta spend a lot of money.
We've said that for a long time.
They had to live on the same mouth and everything.
Medicines before you
Things have
get
changed
to that.
rapidly.
You're going to have? Yes, ma'am.
Back to the donut hole,
Huh?
your prescriptions,
Mm-hmm.
you can talk to your pharmacist.
Right.
And he or she can give you a list of drugs,
Hey, I try to
generic
stay up
type
on
drugs,
this.
other drugs that may cost less. And
Mhm.
you can show that to your doctor or call your doctor with the information and see if he can change it to something different.
That's right.
Yeah.
That's right. Again, it's communicating with your doctor, communicating with your pharmacist. Yeah. You know,
May not
and it may not. Right.
agree with that.
Right.
I'm a 96-year-old mother,
Mhm.
and I got a list of generics, and the doctor will not agree.
Well, I had a gentleman, and you're right, I had a gentleman that pays $1,000 a month for one prescription
Oh, my God.
because it's brand, there's no generic for it.
Yeah.
And his doctor told him, you don't have to take it, but you have no other option. So sometime you're in a situation where you got to decide. You have no option. Until they come out with something that can help him.
But we
Yeah,
did
yeah.
have generics.
Yeah. But
List of generics, but the doctor would not agree.
so maybe the doctor feels and ask him again.
96 years old.
Yeah. Right.
Well, a month
Yeah.
ago, I told the doctor I didn't,
Yeah.
I said, I don't
And you
know,
can-
it was, I had to put $50.
Right. And you can ask your
I can't
doctor.
afford
You
it.
don't.
I can't afford
And
it.
again, it's you the patient. You know, you the patient. You the one who have to talk up and say, you know, this make me feel bad, or I can't afford it. Whatever situation, but talk to your doctor and keep asking them and ask them why. You know, you're not out of line.
Said it's pure.
Again, it's the doctor. This is your annual, your deductible for your Part B. As you see, it's $147. Your co-insurance is 20% of the medical approved, and of course, your monthly premium is $104.90. It used to be $99 and something. Now it's gone up to $104.90. Again, if you see at the bottom here, we talk about your annual income.
That'd be nice.
Yeah, most people are gonna fall under that first one. Because, I mean, let's face it, nobody can afford. I mean, nobody making that kind of money today. Right. Right. And that's on the back side of this brochure in your packet. You'll see the dollar amount based on the income. Again, everything as you're going to see, everything you probably hear is about a penalty. If you don't enroll, if you don't do a certain thing, if you don't sign up, there's penalty. You see again? And this is Part B. That's why you want to stay on top of it, because it doesn't go away. For as long as you're in it, stays there. As long as you have Part B.
Don't you
Oh.
automatically sign up every year, though? Isn't it automatic, or you have to send something? I'm trying to remember.
No, once you're in Medicare, once you sign up, right, but that,
I thought they automatically.
no, you probably talking, well, that's an extra health thing you have to every year be analyzed to see if you still qualify for it. Mhm. Oh. Special enrollment. Oh. Oh. Special enrollment means there's many ways you get special enrollment. First way you get special enrollment, if your plan leaves you, as you see a lot of companies have decided they're not going to do business in this area anymore. You can, on that scenario, you can automatically go to another plan without any penalty. If you retire, and you remember, you decided not to take Part B, now you want to get Part B, you can have a special enrollment. Again, another way of special enrollment, you can get in without a penalty. If you qualify for extra help, we'll talk about that down the road, you don't have a penalty. Medicare Supplement, also called Medigap. Again, you see, Medigap pays that 20% that you pay. Get them off here. It pays that 20% that you pay, and if you get a supplement, Medigap, you pay the premium for Medigap, but you don't pay the deductible, the copay, and the other thing that you would have to pay if you didn't have a supplement. Guarantee issue in the first 6 months becoming Medicare eligible. Special enrollment period, you got that 63-day window to do that special enrollment. If you go beyond that, again, we're talking about you can't do it again until the next enrollment period. You're going to see that come October, every year, October 15, December 7, you can switch or drop during that period. Can't do it before then unless it's an unusual circumstance where the company left you. And it tells you here, if your group benefit terminates or the plan leaves you, as you see going on, you're going to see going on. Are you all aware that plans are different for every parish? That you may have somebody, a relative in another parish that might have the same plan you have, but you may be paying a deductible or something that they're not paying. They're different.
What is Medicare is different depending on the parish? Is that what you said?
No, the provider. Your provider is different. In other words, you may have Humana. For instance, St. Bernard Parish have Humana choice.
You're
Well,
talking
it's going.
about supplement.
No, I'm talking about your providers now. Your providers.
Okay.
Okay. They are going away in St. Bernard Parish, but they still have that plan in St. Tammany. See the difference? So, if you ain't St. Bernard Parish and you don't have that Humana Choice Plus anymore, you have to take another plan. If you have a provider plan, Medicare Advantage plan, you have to take a plan that's on that list for that parish. They're different. Understand that?
He's talking about your secondary.
The secondary insurance, your supplement, that's what you're talking about.
We're talking about your Medicare Advantage plan. If you with Humana, if you with
You're
People's
talking
Choice.
about Medicare Advantage plan. You're
Right.
not talking about
Right.
if someone has their supplement outside of Medicare.
Right.
Oh,
Right.
okay.
Your supplement you can have anywhere.
Yeah. Provide anywhere.
That's part of your original Medicare. What's good about your original Medicare, you can go anywhere. But once you can go anywhere and it goes with you. But if you get into a Medicare Advantage plan, you're restricted because of network.
In other words, you're saying if we leave, somebody moves to St. Tammany Parish and we have something here,
Under
if
state.
you're under that, you may have to go to something else.
That's right. Exactly
Or
right.
you can go back to traditional.
Or go back to original Medicare.
Okay. If
Right.
there's a change with your provider or your location.
Right. Or you move. Right. Right. And a lot of providers have a right to drop plan or leave a plan. You can't stop that. We can't stop that.
That's what scares me.
Right. Nah?
That's what scares me.
Right.
What was that?
That's what
That-
scares
that-
me. That they might drop a plan sometime.
Right. Just like the same way they drop certain brand name. There's no control on that, unfortunately. Okay, down here where they're talking about that same window applies to your first year Advantage plan, your Medicare Advantage plan. That means if you join a Medicare Advantage plan in the first year, you decide it's not for you, you can revert back to original Medicare. Understand that? And give you that window that you can go back if you made a mistake. This is your Medigap. I'm sure most of you are familiar with it. The thing here on your Medigap, and everybody, well, I want to get your report. Everybody call F the Cadillac, which means if you got F in your Medigap plan, you have everything. Anyone has a Medigap plan in here? Okay, good. And this how it breaks down, but usually the key to this one is if you have F.
About a supplement.
Supplement, ma'am. Yes, ma'am.
Okay, I've
Supplement.
got that and I've got F.
You got- Good. So you got the Cadillac, as they call it.
Is that what the definition of Medigap is, a supplement?
Supplement.
Okay.
Yeah, it's a supplement. Yeah.
I feel like we gotta take a college course to understand all this.
Right, and the confusing part of it is the names are all so close alike. You know, Medicare, Medicare Supplement, Medicare Advantage, you know, Medicare, yeah, Medicare. You see, it's all it's just
That's part of Medicare? Medicare, part of Medicare?
yeah, yeah, Medigap is the same as a supplement.
Medicare Advantage is like the
As an option. Right, Medicare Advantage is the private sector of original Medicare. If you, right, and look, so you'll answer your question. If you look at this sheet here in your packet, have the red light. Where did it go? See your red light? It tells you about original Medicare. Look at your red light. Tell you about original Medicare and Medicare Advantage plan. And what the side tells you based on your choice, and it tells you if you go or don't go, or ask more questions. You want to have this? Again, when you talk about a supplement, you're talking about, original Medicare.
I'm interested in if the beneficiary cannot afford a supplement plan, but still wants additional coverage.
You get see.
What's the other option?
Medicare Advantage. Medicare Advantage is the same as C. You know A, B, C, D? You say Medicare Advantage, you're talking about C.
Is that the other option?
It's the same as C is the same as Medicare Advantage, same name, and that's your option to original Medicare.
A different.
Well, does not Medicare and Medicare Advantage doesn't cost as much as just a regular supplement or Medicare?
It depends on what plan you choose. See, every plan is different.
If you want additional coverage, there's another option, but
Well-
why get another option if it's going to cost as much or more?
Well, it's because you heard the advertisement. A Medicare Advantage plan is a consolidation of A and B and C of it, which is they'll give you, most Medicare Advantage plans will have a prescription drug plan with it. Most. Okay. Now, they also offer you other things. Some may offer you dental. Some may offer you vision. May offer you a gym membership. May offer you a pickup service 5 times a year. You know, they're private run in companies, so they can add little perks to it. So to answer your question, why would I go to the other? Suppose you want all that.
Yeah.
But you're
You
going
see?
to pay more money.
Well,
You're gonna pay more money in the long
that's
run.
it depends on the individual.
And you can't see any doctor or you got.
Well, I'm getting that. That's right. You got to go in network, HMO and PPO. But a lot of people want that. A lot of people say, well, you know what? I want to have vision. I want to have dental. I want to have a membership. I want to. So that's why every plan, Medicare Advantage plan based on the company, is different. And when you look at their plan, some of them may have a deductible, some may not. It depends on what you want. So even though it's called an option, still in the option, you have to decide what plan fits your need.
I have a sister that she's a pill. I wouldn't want her as a patient. Anything to do with her if I was a nurse in a hospital or anything. But she lives in Lafayette and she's on the Humana plan.
Yes, ma'am.
And I can't get the straights from her. I don't know if she's telling me the truth or if they just have not wanted her as a patient. But she's having a hard time with the Humana plan to find doctors and
My sister's also on that plan.
hospitals to take her because the doctors don't want to be involved in that plan.
That's going on, ma'am. You're actually correct. It is going on. Again, it's as you see up here, it's run by private companies, so they can, that's why you see such a difference, and you have to decide. Now she could, right, and again, like they say, you in a network. If you go with the HMO, you have to have a primary care physician to recommend you to go to a specialist. It's a lot of restrictions.
She went to a neurologist yesterday that
Right.
she had to pay for out of her pocket.
It's a lot of
But she
restrictions.
couldn't find a doctor in the network.
again, it come down to you. You want to make the decision based on what you want. And again, you know, no one at this point can control the private. And see, this is what they offer. Yes, ma'am.
But it's like she said, you know, her sister, she's dissatisfied. She can get out of that.
She sure can. That's what I thought. She can go back to original Medicare.
Well, she's wanting to right now, but I don't know really. I get bits and pieces of her story.
Yeah. And that's why you have to get,
really know.
and that's why you can have her call us.
Yeah.
That's why you have to get, when people give you bits and pieces to make this thing go, you have to know the whole story until you can hear the whole story. We talk to people every day, and they give us a story today. Well, when we have difficulty trying to give them an option, we find out once we do the analysis that, wait a minute, you're already getting this. Well, I forgot to tell you that. So you have to get the whole story to be able to determine your particular situation. That's why at the beginning I say everyone's situation is different. I had a lady we were trying to help to qualify for extra help, which is LIS, with low income subsidy program based on her income, and she swore up and down, this is my income, this is my income, this is where I am. When we qualified her, and to find out she was getting a retirement income from her husband that she didn't say, well, that knocks you out. So you have to get all the information for anyone, no matter what plan you go with or who you go with. You have to get all the information so you can make an intelligent analysis and then come back and say, okay, here's where you are, here's what you have. But if you leave out something, it's no good. So tell your sister to give you all the information. It's for you. But this is your Medicare Advantage. This is what they offer you. And believe it, a lot of people want this. You might not want it, but a lot of people want it. And they just say, you're right, there's nothing free. We know that. No matter how it's packaged, there's nothing free. But if that's what you want, that's part of that plan. Now, like you said, if you don't want that, when you get out of it, you can go back to original Medicare. And these are the types of the Medicare Advantage plan. And you see all your restrictions. Your health maintenance organization, everybody knows about the HMO. And you see the restrictions? Again, in network. If you go out of network, who knows what happens when you go out of network? My friend here, you know what happens when you go out of network when you're one of these plans? Cost you what?
You pay for it.
Exactly right.
Whatever it is.
That's right.
It's $1
See?
a month.
So that's why you got to understand when you join the plan, you have to ask the question and understand, what happened if I go visit my daughter in New York or out of the state? What happened?
Usually you call
You
the
see?
insurance company and tell them I have an emergency, and sometimes
Right.
sometimes they'll let you.
Sometimes they'll let you.
Sometimes they won't.
You know. Again, the PPO. Now you don't have to have a primary care physician, but in the PPO plan, you're still restricted. Private fee for service. Anybody know what that one is? That's where you have when you join a contract with a medical hospital, clinic, whatever, and you signing it, but you're saying that under their guidelines, you're going to abide by it, and this is what you're going to pay. That's not usually a biggie here, because that's the one-on-one contract you have with the doctor or clinic that you're gonna buy their plan, and you're gonna that's a one-on-one contract plan. But you with the doctor, nothing to do with you're gonna be qualified. And well, he said you have to pay based on your contract with them. What you pay, called a private fee for service. And of course, your special needs plan, that's for people who, and some companies do offer that. If you have a special illness, some people still offer that. They'll still cover you, but it's at a higher cost. And you group people. Again, you're going to see down here on your special needs plan. Now, of course, we don't have anything to do with Medicare. That's with the state. But under the extra help plan, based on your income, they will qualify you based on your income for extra help. And if you don't answer question 15, they will also try to qualify you, which you're going to see down the road, for Medicaid. And we're going to explain the LIS, the Low Income Subsidy Program, extra help, and the Medicare help down later on in the presentation. Okay, what are benefits paid with Part C? Because on the Part B, you're still going to have your premium for Part B. You're going to never go away. You want to understand that? That $104.99, that's never going to go away. And then you may have an additional cost that you might have to pay. I mean, if you have the dental and you have the vision and you have this extra thing. And then, of course, your copay, your deductible, your co-insurance, they're going to vary from original Medicare to the Medicare Advantage. Again, as this lady said, you're going to pay for it, but what plan you're choosing is going to determine how much you pay. But one thing going to be consistent, the premium from Part B is not going away. Yes, ma'am.
Do the Medicare Advantage plans, because they're still like Medicare, do they still have to cover everything that Medicare?
Yes, A and B.
Medicare
A and B, that's covered. A and B is standard. They have to cover that. All they're doing on Medicare Advantage plan is consolidating A and B, and they're adding a prescription drug plan, and they're adding vision, and they're adding.
But they still have to cover, like,
right,
you know, everything.
right.
There's nothing they
That's
can't
right.
deny the traditional Medicare.
That's right.
Okay, thank you.
And as it says here, plans vary from plan to plan. And you can ask, whatever plan you're in, you can ask them every year, every month if you want, what other plan that you have that I might can look at and see. Or they can do the same thing we're going to do. They can do an analysis for you and show you, okay, we have this plan you on, but we also have this plan over here. A lot of people don't ask the question. They don't ask them to look at what can be better for you.
I would suggest one of the best things that people can do
Yes, ma'am.
is
Wait, I can't hear you, ma'am.
I'm sorry. One of the best things that we as patients or people can do is to ask the doctor, what plans are you on and do you intend to stay on them? You know, on
Yeah.
the healthcare advantage. Because,
Right.
You know, if you have a good doctor, you may not want to leave that doctor to go to Humana.
Right, that's it. Right.
But if that doctor recommends a certain specialist, that Medicare Advantage might not take care of that
He's supposed
specialist.
to send you to a specialist within that, like if it's Humana.
Within that network. Within that network.
But they have, occasionally, there might be a specialist that they don't have, and they might make exceptions. Is that still true? You know, if there's a
No, if it's that,
specialist
if
that
it,
might send you out to, like, to Baton Rouge instead of somewhere.
yeah, and again, if they do that, the doctor have to write a letter. They have to get to the Medicare Advantage, whoever it is, whether it be Humana or people, whoever. They got to get them involved.
So if you're really sick,
So, you know, it's like anything else. Prior authorization, you have to get all this in advance. I had a situation, I take a physical every year, and to show you how things can happen, why you got to pay attention, is every year I have a physical, and it's the same thing. This year, well, at least November, I had a physical, and the doctor said, I'm going to test you for this. I said, test me for anything you want, long as it's under my plan. Well, he tested me. A month later, 2 months later, I get a bill saying I owe $300 and some odd dollars. Wait a minute. I don't owe anything. I paid my $25. I shouldn't owe anything. So round and round we go. And first of all, they didn't call and get an authorization, number one. Number two, they didn't tell me it was outside the plan. 3, they coded it wrong. So you see how sometimes you're fighting a battle, but you got to get to the root of, okay, what did you do what did I know you're doing, and what did I authorize you to do, and what did you do that you didn't get the authorization from the plan? And then that's where the ball game begins, because now the burden of proof is on who? Always you. Always, and you can get in trouble. I tell them, I got in trouble. Didn't know I was in trouble. I mean, it can happen to you. You get in trouble. But that's why you got to look at when you go to the doctor, and you ask the question, and look at your bill. And when you get your bill, look at what they did, and know what they did is what you were told that they were going to do, and you authorized them to do. Because you can have something on your bill, and it doesn't have to be fraud. It could be putting the wrong thing, I mean, now you paying for something. Wait a minute, I didn't have this. Now to go back and reconstruct all that, that's for the paperwork comes in, and that's where we can help you also. Yes, ma'am.
I had a knee replacement before I quit, still working, and with my job, and I had good insurance, but it was, I could see certain doctors, go to certain physical therapists. Well, the doctor said this physical therapy, they did not check it with my insurance. I ended up paying several $1,000s for
Oh, it can happen. It can happen.
Let me tell you, before I go to anybody these days,
You got to ask them. You got to ask them. Look at your plan. Look at what you know you have, and at that front desk when you go there, at that that reception desk, you know how they always ask you, give me your card and make a copy of your card, and say, now look, tell them just like this, don't do nothing that's not covered. I mean, you know, that's it, because you can end up paying, like you say, and I'm getting this problem solved with me, but suppose I didn't know to look at the bill. And that's why I said, how many times, you know, my mother-in-law is 90 years old, and you know, she forgets, and she don't ask the question, but she don't look at the bill, and then so we got to go through the bill to make sure this is what you got, this is what happened. But if it's not, she don't know who to call to change it or to get the root of the problem. Okay. Who's eligible for Medicare Advantage plan? You must live in the plan service area. That's what we just got through talking about. You must have both Medicare Part A and B, and you can only belong to one plan at a time. Any questions on that?
What does that mean, if you don't belong to one plan at a time?
You can't belong to two plans. You can't belong. You can't belong. No, A and B. You must have A and B to have a Medicare Advantage plan, because all Medicare Advantage plan Part C is A and B prescription plan and whatever perks you want to add to it. When can you join switch plan? And these are important days. I remember October 15 to December 7. Again, you can join in that 7 months period. That means that 3 months before of your birthday, that month of your birthday, and 3 months after. And this is coming up. This is where we get the most volume of calls from people in the whole state, October 15 to December 7. I mean, volume of calls. Special enrollment period, when I say that, if you leave the area, you can have a special enrollment period. If you cannot stay in the plan, you want to leave the plan. If you leave the plan, you can revert back to original Medicare. Here's a time you can drop a Medicare Advantage plan. This date. You can leave a plan. You can go back to original Medicare. You can be, and of course your coverage is going to be in the first month after you leave the plan. You can make changes. You can also join a Part D prescription plan to add drug coverage. And again, you're going to begin the month after the plan is enrolled, but you cannot join another Medicare Advantage plan during this period. And that's January 1st to February 14th. That's another high volume time. Again, if you're not reviewing your plan, you don't know if you need to change, drop, switch, if you're not reviewing it. And again, you got to talk to the doctor to find out if you're not pleased with the situation, you're not pleased with the service. But if you're happy with the doctor, if you're happy with the hospitals and the pharmacists, you have no problem. Again, prescription drug plan, they're approved by Medicare. These are companies like the Humana Store. They're approved by Medicare. They're all private companies, and they're available to everyone with Medicare.
I don't know how you get Part D pays for your prescriptions.
In your Medicare Advantage plan, they're going to offer you, it's going to be Part A and Part B, and they're going to give you a prescription drug plan based on your relationship or what you decide the plan you want in your plan. You don't have to have a prescription drug plan in the Medicare Advantage plan, but if you try to choose one, it's in there. You can have a prescription drug plan outside of the plan, too.
I have to talk to them people.
Mm-hmm. Costs vary by plan. We've been discussing that. Again, it's your choice. When you're talking to them, you should ask, if they give you one plan, ask what other plan you have. At least give yourself options. Don't just look at one plan, look at various plans they have and see if that fits you. And plans need to fit not only your doctor that you might feel want, need to fit your hospital that you're satisfied with, or pharmacist. It also has to fit your main thing is what? Your budget.
Yeah.
Your budget is the key. And the reason why it costs you more is because of what added things you may get in that plan. When can a beneficiary enroll in Part D? And those are the dates and the months you can enroll in. Before you enroll in, if you want to get an analysis of where you are and what's your option, that's why you need to give me these forms, leave those forms for you. Let us talk to you, tell you where you are, and show you some options. We don't make the decision for you, we just give you the information. And here again is the different scenario where you can enroll in a special enrollment period. That's if you move out of an area, but naturally if you move out of Lake Charles and you go to St. Bernard, your plan is not there. So you can switch plan. Or if you lose credible insurance, credible mean that if your retired company, whether it be a union, whether it be like steamship company, okay, if you lose that, remember I said you had 8 months, you have 8 months to get into another plan. And the beneficiary wasn't adequately informed, other coverage was available, nor credible, nor was reduced and no longer credible. That means you get in the plan and they give you one plan, you say, you know, and they come back, I didn't know you all had this other plan. That's why, again, you have to ask, and you can go back and say, okay, I didn't know you had this other plan is better for me, I want that plan. Beneficiary live or leave. Now, would this be if you again, you leave or you live or you have a long-term care facility, that's going to affect you having a special enrollment plan. Beneficiary have to continue special enrollment if you qualify for extra help. Extra help that we keep talking about is this brochure here. This brochure, and if you open it up, this side, it's under the Medicare Social Security plan, which extra help based on income. This side is Medicaid. Side that's under the low-income subsidy, extra help based on income. If you qualify, at the bottom down there, it shows you what it pays for. And that should be underneath. We're going to. If you qualify for LIS, which is low-income subsidy, it will pay for the check marks at the bottom. It will pay for any late enrollment penalty you may have. It will pay for the monthly premium, the deductible, and the copay. And again, it would be on the full benefit Part A, Part B, or partial benefit. Again, it's based on your income. A little flexibility here on this one, for a little subtle, because your income may be higher, but if you're responsible for someone else, which means your income is not going just for you, it's going to help maybe a sick relative, a grandchild, or daughter, or sister, or brother, they'll take that in consideration. Now, Medicaid, on the other side, there's no leeway. You have to fall in those guidelines for Medicare savings plan, and if you do qualify, then it will pay for, besides the late enrollment penalty, Part B premium, Part B co-insurance, and Part A and B deductible or co-payment, if you qualify. That's why when you fill out that, if you talk to us and you qualify, and we fill out the form for you online, we won't fill out question 15. You don't have that envelope or that application, but question 15, we don't fill that out. They will see if you qualify for both sides. And if you do, it's called dual, then you get help on both sides, and then you're not using your money to pay the premium of those things. That's extra help. That's what saves you money there. Again, we're talking about late enrollment penalty. Again, you see that 10% is almost universal. In everything you do, if you don't enroll, you got that 10% penalty for each month eligible and not enroll, for as long as the beneficiary has Medicare. And if you take the national base premium, which is $31.17, and as you see, and it changes every year, if they take 10% of that, that's $3.11. You keep adding up every year. That's what your premium keep going to. That's because of the late enrollment penalty. And again, it changes every year. We talked about prescription drug, brand name versus generic. This is an area here that you really want to talk to your doctor about. You really want to know what you're taking. You really want to be on top of it, because one change, one new generic come aboard, or alternative, or equivalent can save you a lot of money. As I told you, one gentleman paying $1,000 a month just for one prescription medicine. If something come about, he can save that. We save, because of some of the other saving mechanisms we use when we do analysis on you, we saved a couple $16,000 a year. They were paying $22,000 a year. Now, a lot of that was again, not having certain information like brand versus generic. We don't know if they talked to the doctor or didn't talk to the doctor. Some of that is changing plans, like the lady said, if you change plan, and if you change the plan, the plan that she went to was better than what she was paying. So again, we don't know all your particulars, but once we do get all the facts and we put it in, that's where we can start finding out what you're paying, why you're paying it. You know there's something else different out here. And if you don't analyze your plan, analyze your Medicare situation every year, you don't know what's out there. Yes, ma'am.
Looks to me like the doctors would know what is generic and inform the patient on their own.
Yeah, you will hope so. You know, a lot of times the pharmacists tell you. You know, sometimes you go to the pharmacy and they'll say, you know, that's a generic for that.
Yeah.
And you say, I don't know. And then they'll say, well, go back and ask your doctor, or we'll call your doctor. You know, but
you can always ask the pharmacist too. There's a generic for that.
Right, and ask them. Yeah. A lot of things you think would happen or would say, or whether it be written or verbal, we don't know why it's not said, why it's not told you. But again, if you could be proactive and ask, you're not out of line asking any question you want to ask. You're paying for it. You know, you're not out of line asking your provider, say, hey, there's something else I can do here.
I found that now people, your providers, whether it be a pharmacist or who are checking things out to see if the insurance you have. They're a lot more conscientious about doing that to date than they were.
You're right.
Yes.
Mhm.
I
I think
got a
because
friend
it-
of mine out of the hospital this morning that had to have a walker and one of the
Scooters
ones
up-
that you sit on
yeah.
top of the commode, and they wouldn't she could not leave that hospital until that
Yeah.
that provider brought that up there, and they called me and said, well, it's been checked out, the insurance is approved, and she's on Medicare and a supplement, and is approved, and she said, we'll be there. I said, we've been waiting, I've been already waiting for 2 hours, I appreciate you getting on.
You're right, and
And they did, but they had called, they had
Right.
checked that out.
but now and the reason is there's so much scam and fraud going on, and
Right.
what happens is the watchdogs are watching closer now, and money is being spent. You know, when you think about the scandal, I'm not saying picking on anybody's name, but the scandal with the scooter store in Dallas, Texas, was one of the biggest scooter stores in the country. If you know, they raided it, CMS raided it and closed it down, and according to what the news people say, they owe like $119 million. You know, when you have fraud, no matter what form, it hurts you. Each person it hurts you, and that's why we have an agency. And in your packet here, you're going to see two things. You're going to see one on beware of scams and fraud, and you're going to see one on don't be a target. Well, there's a company called SMP, Senior Medical Patrol, that you think you're being scammed or you think you're being fraud. You can call them up anonymously and say, check on this. This is happening. I'm getting a phone call. You know how people call your house and say, we want to help? Well, do you know that's against the law? That's against. But if you, one thing, if you can stop that. If you ask them, give me your name and your phone number, I'll call you back. I bet you won't get it.
If you even, nowadays you get all these calls and
Right.
there's nobody on.
Nobody on the line. Yes, ma'am.
My mother lived in a small town, and she was disabled. Of course, she was on Medicaid. And they had an individual come knock at her door and tell her she could have a scooter. And
Big time no.
Yeah, and they had a doctor. She didn't have to get permission from her doctor. They had a doctor out of town sign papers. When my sisters and I found out about that, we were upset. We called Medicare to turn them in. They act like, oh, well,
They don't do anything.
we'll
But
check in.
this company here, you might want to call them up. If you do not have, call us. If you have,
So upset.
if they don't do anything, call us, because we have to report things to CMS, Center for Medicare and Medicaid, because no one's supposed to come in your house. Number one. Number two, if they're calling you, they're not going to give you their name and their phone number, and don't ever give them any information over the phone. That's how so much scam and fraud, because people think they're getting something for nothing. The word is, well, you're entitled to this. All you have to do is give me your Medicare number, and we'll take care of it. Well, guess what? If you give it to them, they use that number to defraud Medicare under your number. Now, you might not know about it 2 years down the road. Now you need a walker. Now you need a scooter, okay? And you call up. They say, well, we already gave you one back in 19 so-and-so. You say, no, you didn't. You say, well, yes, we did. Now you upset, right? Why? Because you gave them the number. See, you gave them the number. So if you're getting these calls from anyone, we had someone that we reported that went into a skilled nursing facility, that went into some of the Center for the Elderly and Disabled, and signed up people on a lot of plans, which you're not supposed to do. That's illegal. But the people signed up, and one of our people, one of our partnering people that monitoring this, had to go down, like we would have to do, and get them out of that plan, put them into the plan that's legal and right, and do the paperwork to notify Medicare, to notify the provider. You see how much work we have to do? Because they just signed thinking they were getting something for nothing, and it was a scam.
They target the elderly, though. That's the same.
That's what it, that's
When you
ex-
get
that's
older, your mind
that.
is not what
Well,
it
that's
should be.
why That's why I said at the beginning, when you have elderly, or if you all want, take somebody with you to ask the question. Just this lady's right. You have to know what's going on, because now they're gonna make sure. That's why you waited, because they're gonna wait. We make that phone call, and my situation came about because they didn't make the phone call. All they had to do was call up and say, "Hey, we're about to do this test. Is it covered?" They would have told them no, or told them yes, but they make the phone call. So some of it is not fraud as it is incompetent.
That's right.
Am I right?
That's right.
It's incompetent. So you thinking, here's my card, you plop it down, and you sitting there waiting, and they're doing all kind of thing, and nobody say, well, you know what? We're doing all this, but you know we're doing it as a outpatient. You're not admitted. You don't ask the question. You thinking, you know, oh, you're gonna be admitted. So, and there's a lot of, contrary to the book, there's a lot of situations that happen that you have to just talk and appeal and appeal and appeal and give it to the doctor. Because there's a lot of miscommunication sometimes between all the different, the doctors and the hospitals and the this lab and that lab. For instance, you don't know that you go to the doctor's office and you get tested to run, right? But you get a bill from a lab. You say, wait a minute, I don't know anything about this. Well, the doctor sent it to the lab, but you don't know nothing about it. Then you get a call saying, well, we didn't get paid. Wait a minute. Well, first of all, I didn't come to you to get anything done. All my work was done in the doctor's office. So you have to know all of the transition that people are going through, because when it come up in a bill, now you frustrated, stressed out. You got to figure out, did I do this? Did I get this? Did I authorize this? Where it come from? I've been fighting my situation for 4 or 5 months. And it's easy because I talked to a person at the lab, and you tell them something, just call the doctor. Do you know how hard it is to get one person to call another person just to solve the problem?
Yeah.
But that's what you have to go through. I don't know the solution to it, but all I can tell you is you got to stay on top of it. And
The only solution is to stay on top of it and ask a lot of questions.
You're right.
from the very
You're right. You got to ask those questions. And if they ask frustrated, like they don't want to answer,
Yeah, get sassy.
well, guess what? You paying for it. Tell me what's going on. Again, your formulary list, we're not going to discuss that. You just know about your list and you see the form. We'd like to discuss that personally in private, because that's a different situation. But all I want to say on that is that if you call us and give us information in that list, we can go into the main system and see where you are, and then we can see what else is out there that you all might not know of, that your doctor may not have said. We can see what's out there, and we don't make the decision. We just say, okay, here's where you could be, and we will say, because you're on the phone, it covers all your meds. You know how sometimes you got a plan, but it doesn't cover all your meds, and you say, well, you know what? I got a plan, but it covers, I'm dodging that light when you see me. I got a plan, but it doesn't cover this, it doesn't cover that. Well, there may be a plan out there that covers everything. But you don't have the time nor the knowledge to know that. So if you call us up, and our number's on the back of all those green brochures, talk to us. We're going to ask you the question based on that same form, the exact name of your med, the doses, what you paid for it. We can tell you, here's where you are, here's some options. We don't make the decision. And then you look at it and say, you know what? Got all my meds here, got my doctors, got this, got that. Then we say, okay, call up this plan, tell me you want to change. Or if you authorize us, we can do it right in there.
And most of the time, the pharmacists won't fill it. If they see you're not covered for that
That's right.
particular med,
Don't want to
they
fill it.
won't fill it. And even so, I took a prescription for my daughter to her where she has, I said, I'm going to do this. It was a new prescription. I'm going to do this while you fill it. Well, I come back and they didn't have it filled. You know why? It was going to cost $200. And I said, well, you have her, her insurance. They said, but that's with the insurance. But anyway, she had to. But they are they did not fill that till I got back there.
This slide tells you about all drugs in 6 categories that are required coverage. Again, I'm not going to get into detail, but you can look at this and see the required coverage. or commercial available vaccine. You know, something that's covered that people weren't aware of is shingles.
Is that vaccine covered?
It is not covered, because I tried to get mine.
You
They
tr-
said, no, I was
It's not covered.
no.
They told us no.
Well, you know what?
Okay.
Hold on 1 second for me. I had this conversation. Now, again, you got to go back and fight. But it is covered.
You're looking for it, you won't be able to find it.
Well, I had discovered this same conversation down in the event, and I want to say it was page 52, and it's covered. The chief, the second one, told me that they didn't cover them, and I got a feeling that something is going on
Yeah,
with the doctors.
they went to the wrong doctor probably.
No, it's something. No, I'm trying to figure out what page it's on in the book.
Said it's page
90?
90. Some lady back there. It's covered under Part D.
Part what?
Part D.
I think it is.
Well, I know I got
Part D. Part D.
Part D, here it is. Now, something is going on. You the second one told me that. I was down in the event on page 90. I was down in the event. They told me the same thing. So we got a feeling. On page 90, on the note, and on the note said drugs are covered, and say medical drugs plan must cover all medically necessary commercially available vaccine not already covered under Part B, like the shingle vaccine. Now, you the second one told me that, and we're investigating that, because find out from your doctor why, if the book said medically necessary that are not covered Part B.
No, because I didn't go through my doctor.
Oh, ah,
I went
I
to,
did,
I
but
went
he
to,
didn't cover.
and it didn't cover it.
yeah, I went to a
Drugstore. But you see what it says there? And mark that page and keep that book with you.
Does that,
It's on page 90. Go down to note. See note? Read note.
well, listen, does
Yes,
that
ma'am.
mean if I went to my doctor, he would have had to give it to me?
Yes, ma'am.
But
If-
Kroger or Walmart doesn't?
No, no,
Well,
no,
I'm trying to
no,
understand.
no,
Because
no.
I've always got my flu shot, me and my husband both, for the last.
You got
And,
The shingles vaccine is only
Robert, Medicare. D.
D is
D.
for dog.
D, right.
It depends on where you
Right, right.
you're getting it from.
That's right.
Go back and find.
Again,
So it depends on who I'm with under Part D.
no,
It depends on my carrier under Part D.
No.
no.
Yes, evidently.
Well, what you might want to do is ask your plan. Ask your plan. Because again, you know, people getting different things from different. Ask your plan.
Well, that's what they
Under
said, that
Part
my
D,
Part D, I'm under-
is it covered?
first health
It should be. It should be. But again, you have to remember, just remember this if you don't remember anything, your plan, your plan, your plan. Talk to them, ask the tough question. That's why I try to teach much as I can from the book, so you can go in there with the book in your hand and say, okay, what does this mean to me and my plan with you? You know,
Did all your family members call you?
ma'am?
All your family members call you?
Call me? No, ma'am, no.
Information?
Well,
Already.
people don't, It's a funny thing. How about you? Any profession, anybody in here, you may be an expert in your profession. How many of your family members call you?
They usually do.
They do?
And I'm
Some
not a
people-
pro- And I'm not a professional.
Some
in any of the things
some
they
people
call
don't.
me.
Some people don't. Because you usually think, well, I don't know if I want to tell them. And a lot of people think the biggest problem I find in the consumer world is people think that their business is their business, so I'm not going to talk about it. But if you don't talk to somebody, how are you going to get help?
Are they gonna appear dumb?
You know, how you going to get the help if you don't know? No, I just read and ask questions and read and ask questions. But our director, Vicki Dufresne, is a master at this. She's been in it for about 15 years. I think she said 15 or 16 years. She's touring also. We just trying to give you information. We're just trying to give you options. But the main thing is you can call that number and we can do the work for you. We can do the work for you. You fill out the form and say, okay, here's my issue. 'Cause everybody's issue is different. Some people's issue, you may think it's monumental. It may be, you call us, you give us the information. We make the call to your plan and say, okay, what's going on here? This lady tell me she's not, you know, she got D and she's not, you know, she should have a shingle shot.
Call who?
No.
SHIIP?
SHIIP, yeah, call SHIIP. The number's on the back of the green brochure.
Is this just the state office, or can we call a SHIIP, somebody with SHIIP here?
Are they local?
No. SHIIP is in Baton Rouge, it's part of the insurance.
But through CCOA, the Council on Aging, there is someone.
Yeah,
that
that's
is
right.
with
She-
SHIIP that can guide you.
That's right, that's right. Now, all of them don't have someone like that. That's why we recruiting volunteer in all of them and trying to train all of them. But yet, get her to do the work for you and find out, you know. But the numbers are on these brochures. That's what we do. We know we get the answers for you. We give you the options.
Jamie Marks, if she's still there.
Drugs excluded. Here are the drugs that are excluded, so you know your plan don't cover it.
It's reporters, you know.
Wait, what's happening drugs for
Ma'am, we go back.
the toes?
Tier. As you know that you have, sometimes your plan to put you in a certain tier to see what, you know, sometimes they want to see how the drug affects you, number one. Number two, they want to see from a cost standpoint, but again, they'll try you out until they determine which drug actually is going to help you. So use a tier type thing. Some plans will use that. Some plans use a step therapy. Here we talk about prior authorization again. Step therapy. What that means is they'll try something. Doctor will try something, try a drug. If it doesn't work, you can go back to your original prescription. Again, they're trying something in some cases to save you money as well as help you medically. Quantity limit. We talked about some plans require a certain limit, and that's to keep you from getting in trouble with too much drugs, also monitoring how much drugs you get. Again, we talked about the low-income subsidy program, which is the brochure. You got no money. Reducing prescription costs, again, it's controlled by Social Security. Extra help, we talked about that, the low-income subsidy program, that's the brochure, and that's based on, again, your income. You can file a paper application, or you can call us up and we can do it for you. Or you can designate someone to do it for you. Again, that's just a slight overview. I try to talk to you and not at you because we want to have dialogue. So it's a little different. We want to talk and try to ask some tough questions, get some answers. The key here is we can help you. We can help you work through the maze. We can't guarantee the result based on what you give us. That's what we can try to get. But again, you now have someone, a counselor. You have someone you can call. Don't get frustrated. Don't have to fight anybody. Call up, say, okay, here's what's going on here. And we can not only give you information, we also can tell you what's going on in your area, what's going on with the plan, with the provider, what's going on with Medicare, what's going on with your drug. We can help you. We have information. You also, in the book, you're going to see a lot of websites. You can call yourself, which is going to give you the same information we're going to give you. We don't cost you anything. We work for you. It's free. And I thank you all.